Hey Alex, how goes it?
Oh, it's okay, I guess. I was in the OR again yesterday, and they asked me if I wanted to sew. I said okay, and they asked me what sort of suture and needle I wanted. I got all flustered and mixed up. At this rate, I don't know if I'll ever be a surgeon.
Hey, don't give up. That's happened to all of us.
Hello, you young Muppets. What are you up to on this lovely bright morning?
Oh, we're just talking about sutures and needles and things.
Sounds like it's time for a little teaching.
Great, I really need to get my head around this suture stuff.
I'll go borrow some sutures and stuff from the OR. Be right back.
Okay, let's talk thread. In the OR, we call it suture or stitch. You'll be using sutures to sew up the skin, to carry out repairs, to tie off blood vessels, and for lots of other things. Whoa, that was fast.
I didn't want to miss any teaching. How far did you get?
We were just talking about sutures.
Great. I can demonstrate for you, boss.
Right. So, you're going to get suture in your hands in one of two ways. First is attached right on a needle, so you're ready to get sewing right away. The second is on a reel or freehand. In this case, there's no needle. You're just holding the suture in your hands so you can tie with it.
If you ask for a suture in the OR, the nurse is going to ask you right back. What sort do you want?
Well, what are my options?
Your two basic types of sutures are absorbable and non-absorbable. An absorbable suture holds the tissues together while the body heals, and then dissolves away. The time taken to do this depends on the suture type. For instance, old-fashioned catgut dissolves in just a few days. Vicryl sticks around for a few weeks. PDS is there for a few months, and silk takes years. Some of these sutures come from natural materials and others are manufactured. The other type of suture is non-absorbable. This type of suture is tougher. It doesn't get dissolved by the body and will be there forever. Usually these sutures are made of synthetic materials and polymers like nylon or polypropylene. Some sutures are braided, which means they are kind of rough on the outside, and others are monofilament, which means smooth.
Okay, absorbable and non absorbable. But how do I know which one to use?
Same as for everything else in the OR, you have to pick the right tool for the job. If you're working on something that heals fast, you might pick a suture that dissolves quickly, like monocryl. If you want to hold something together for a long time, you might pick a suture that dissolves more slowly, like PDS, or one that doesn't dissolve at all, like Proline.
Okay, so after I pick my suture, what's next?
The next decision you're going to have to make is what size of suture. I don't mean length, I mean diameter. Like how thick. This part can be confusing, so pay attention.
Okay,
The thicker the suture, the stronger it is. When we first developed sutures, we named them by their thickness. Number 1 was the thinnest, and number 6 was the thickest. So big numbers equal thicker. As time passed, we got better at making sutures thinner than a number 1, so we added a 0 suture. This is also called an O suture. This is where it gets complicated. Because we started to be able to make thinner and thinner sutures, we had to think of a name for sutures thinner than O. We decided to name down from the O. So the first one was 2O, then 3O, and so on. So far we've got down to 11O. 2O is about a third of a millimeter across. 5O is a tenth of a millimeter. And 11O is about a hundredth of a millimeter. It's hard to even see that baby without a microscope. You can see when you're in the O's. Bigger numbers mean finer sutures.
In practice, most surgeons will use a big suture like a number 1 to close tough fascia. They'll use a 0 or a 2O to tie off blood vessels, and they'll use a 3O or a 4O on the skin. You might see the vascular or plastic surgeons use a 5O or a 6O sometimes, and the eye surgeons use the 10 and 11O on the eye.
So, pick the right suture material and pick the right size.
great. So now I'm ready to sew?
Well, let's say you want to sew up some fat. What sort of suture do you ask for?
Um, a 2O Vicro?
An excellent choice.
Phew!
Okay, so the nurse says, on a reel or a needle, doctor?
On a needle?
Great, 'cause you're gonna be stitching. Now, the nurse asks, what kind of needle do you want it on?
Um, see, I'm so screwed.
Okay, let's talk needles. Just like sutures, there are different shapes and sizes for different jobs. Basic shapes are straight and curved. You can use the straight ones by hand, but a lot of places have stopped using them because it's just too easy to poke yourself with them. See, so let's stick with the curved needle. There are lots of different shapes, going from a quarter circle to a half a circle. There are also needles that are partially curved like a ski, so that they can fit down a laparoscopic port. One of the most common needles is the half circle, also known as a CT. CT is the biggest, and then CT 1, 2, and 3 are progressively smaller.
Bigger needles tend to come attached to bigger sutures.
There are also different shapes of the needle, including taper, cutting, reverse cutting, and blunt. The different types aren't super important, but traditionally we use a cutting needle on the skin and a round body or taper on softer tissue. When the needle arrives in your hand, it's going to be armed and ready to use. It's going to be mounted on a needle holder. I don't ever want to see you mounting your needle in a snap or in a clamp or even in a pair of thumbs. And you shouldn't ever be holding a needle with your fingers, unless you want to get pricked.
Got it.
The needle is usually mounted in the instrument so it's held about 2/3 of the way back from the tip, and it should be pointed at 90 degrees to the needle holder, ready to use. When you're passing the needle around during an operation, remember that you have to be careful. Treat it just the same as you would a scalpel. Don't wave your needle around, and don't make any sudden movements. Before you do anything with it, you make it safe. You're going to turn the needle around so it's in line with the instrument, with the point towards you and resting on the needle holder. That way, you can't stab yourself with it even if you tried.
See? Totally safe.
We covered a lot of ground today. Hopefully, this will help you when you're working with sutures and needles in the OR. What pearls did you pick up, Grasshopper?
Let's see. Number 1. Pick the right suture and the right needle for the surgery. Number 2. Sutures can come on a needle or freehand. Number 3. Sutures can be absorbable or non-absorbable. Number 4. Sutures are different sizes. They get thicker as you go up in numbers and thinner as you go up the O's. Number 5. Needles are different shapes and sizes too. Number 6. Hold your needle in the needle holder, 2/3 back at 90 degrees. Number 7. Treat your needle with respect. Make it safe before you hand it back.
That's really good. You take the best notes, Alex.
And this is all going on the YouTubes, right, Thumbs?
Yes, sir. Just as soon as I take a post call day.
I love the internets. Right, let's go and do something more interesting. To the wards, Team Scalpel.